One day, Dave was called into his boss's office and told that he was among the 10% of employees being let go. Devastated, Dave desperately searched for a job so he could support his wife Marjorie and their 2 kids, who were 5 and 3. A few weeks later, after having found a job but still without insurance, Dave found out that his wife had cancer and needed treatment immediately. However, Dave could not afford these treatments since he no longer had health insurance. Worse yet, he found that no insurance company would take him on since his wife had cancer. Circumstances very similar to these are a reality all over America and have become the driving impetus behind Democrats and Republicans seeking to reform the healthcare system. However, both sides strongly disagree on how to do this. During the time I have spent studying the debate over Obamacare, I have come to have a deep respect for the individuals of both the Democratic and the Republican parties. That respect does not, however, permit softness when it comes to holding fast to beliefs. Beliefs are part of the reason why the chair member of the Budget Committee and Congressman Paul Ryan's Patient's Choice Act should be implemented. Beliefs are not the only reason, however, since it also accomplishes 3 important tasks. First, it puts the individual back in charge of healthcare decisions. Second, it spreads those who are high risk among insurance groups. And third, it is not only estimated not to cost the taxpayers any more money, but is also supposed to put some money back into the taxpayers' pockets. Because of what it accomplishes and its beliefs then, Paul Ryan's plan should be implemented to reform the healthcare system. To further explain why and how Ryan's plan works, let's compare to Obamacare through the use of the three scenarios which are most often considered when discussing healthcare reform. First under the microscope, Obamacare. Beginning with the scenario previously mentioned, Dave, what does Obamacare do for Dave? First, Obamacare mandates that every individual must have insurance. This is not a problem to Dave since he desperately needs insurance. Obamacare also mandates that all insurance companies must accept all applicants for insurance, even those with pre-existing conditions. This will make it easy for Dave to get insurance for his wife. However, after Dave has had his policy for a while, he finds that there are several items in the policy which he does not need. But he is also informed that he cannot get rid of these items without the policy being known by the government. Since not everyone is in Dave's situation, however, let's continue on to a second scenario. Mary is a single woman in her mid-30s who cannot afford health insurance. Under Obamacare's mandate that all individuals must have health insurance, unfortunately Mary will be forced to pay a fine since she has opted out of having it. Obamacare also, however, mandates that all small businesses with over 30 employees must provide health insurance to their employees. Mary's employer does offer this insurance. However, she still cannot afford it since she is living strictly from paycheck to paycheck. Let's move on to, now let's continue on to the final scenario. John and Margaret are an older couple who have recently retired and have an insurance policy, but who are living on a relatively strict budget. Obamacare holds to its promise that it will not affect those who, like John and Margaret, already have health insurance. However, Obamacare also affects them in an indirect manner. Because of the large number of people with pre-existing conditions getting health insurance, the company must increase John and Margaret's premiums, which causes them to worry about their budget. These scenarios are grim and are obviously not the only situations faced by Americans regarding healthcare reform, but they do show the most faults within the plans because they discuss those who are in the most desperate situations. Now that we have looked briefly at Obamacare, let's now point our attention to Ryan's plan. Beginning with Dave again, what does Ryan's plan do for Dave? Ryan's plan has the state governments set up auto-enrollment centers across the state in convenient places, such as the hospitals or even DMVs. It is to one of these auto-enrollment centers to which Dave will go to get health insurance. The insurance companies which have opted to work with the state exchanges under Ryan's plan must accept all applicants with the promise of financial incentives from the government to help pay for the extra costs of insuring those with pre-existing conditions. Upon arriving at one of these auto-enrollment centers, Dave is able to sit down with a knowledgeable person and discuss which of the participating insurance companies will offer him the best coverage for the lowest cost. Now let's look to the second scenario. Mary. Under Ryan's plan, Mary is not mandated to buy health insurance. Therefore, she can continue on without making any changes. Ryan's plan does, however, make reforms on the current tax code system, which, according to Paul Ryan, will ensure a vast majority of Americans enjoy a reduction in their tax liabilities and will redirect the tax benefits from corporations directly to the patients, which will increase wages for hardworking Americans. To Mary, this means that she will be able to keep more of her money and get more money because of these reformed tax codes, thereby allowing her to be able to purchase health insurance. Now, what about the third scenario? John and Margaret, since they are living on a relatively strict budget, are worried about the plan's effect on them. However, Ryan's plan also holds to its promise not to affect them because they have health insurance. However, Ryan's plan does affect them in an indirect manner in that they also will enjoy the reduced tax liabilities, allowing them some breathing room when it comes to their budget. These scenarios have revealed much, but now let us look at, again, I would like to point out that these three scenarios are not the only situations faced by Americans, but they are the three which are most concern both sides of this heated debate. Also, these scenarios have revealed much about these plans, but let us now look at what exactly they show. The scenarios taking place under Obamacare show two things. First, it shows the beliefs upon which Obamacare acts upon, which are 1. Healthcare is a right which must be provided. 2. Government knows what is best when it comes to healthcare decisions. And 3. More money spent equals better results. The second thing these scenarios show is that these beliefs result in a plan that is fast off the line and does well in the short sprints. But in the long, grueling test of endurance, it falls, winded, exhausted, and short of the goal. Likewise, these same scenarios show two things about Ryan's plan. First, it shows the beliefs upon which Ryan's plan acts upon, which are 1. Healthcare is a privilege which must be provided, which should be available to all Americans. 2. Individuals know what is best for Americans for themselves regarding health insurance. And 3. Money should be spent more wisely and more efficiently to get better results. The second thing these scenarios show about Ryan's plan is that these beliefs result in a plan that is slow to start and seems to lag behind in the short sprints, but which endures the long, grueling test of time and achieves the goal. This goal of healthcare reform, however, will never be achieved under Ryan's plan if it is not first implemented. That means that the very beliefs upon which Ryan's plan acts upon, so also we must act upon. Therefore, it is our responsibility as free American citizens to further educate ourselves about each plan. It is our responsibility as free American citizens to share what we know with others. It is our responsibility as free American citizens to let our elected officials know what we believe and how we would have them to act upon these beliefs. In short, the future of our healthcare system relies upon us, the citizens of the United States of America.